Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today, we all must remember Dr. Larry Ladi. He's been a regular on this podcast. He specializes in critical care, interventional pulmonology, and emergency medicine. He's American Board of Internal Medicine, Advanced Cardiac Life Support, American Heart Association, and Cert 5 in Advanced Trauma Life Support. When Dr. Ladi is not in the ER, he treats people with pulmonary issues and critical issues, and then spends time with his lovely family. Before we get started, I want to update on that little mini Dr. Ladi.
Yeah, mini Dr. Ladi, he's taken my heart by storm, I know. So I'd say hi to all the listeners out there. I have a little 2-year-old who his name's Leighton, and he's like a lightning rod. He's fast, and you just got to kind of keep up with him.
Spitting image of daddy.
Hey, you know what? He's a spitting image of daddy, that's for sure. Can't deny him.
Well, Dr. Ladi, we're glad to have you back again today. And thank you for all you've done during the COVID situation. Y'all have spent countless hours taking care of patients and really sick patients. The COVID, I'm not going to say is over, but it's slowed down.
Correct.
But it seems like people are still sick. So what are the after effects of COVID?
The after effects it's a huge area of after effects. So there are 3 major organizations, one of them being the CDC, the World Health Organization, the National Institutes of Health. They're all trying to put together a definition of these after effects. So we kind of heard the word tossed around, long COVID or long COVID syndrome or post sequelae of COVID-19 disease. There's a lot of these little mnemonics on what the name of what disease pathology we're looking at. But basically what it is we're looking at patients who have or who had COVID and a prolonged case of it or prolonged symptoms of COVID. And that's kind of considered a long COVID. Everyone's trying to put a definition to what symptoms are they? What's everything? It can be from breathing issues. It could be from sleep issues, irregularity in sleep. People could have rashes that show up that weren't before, loss of taste or smell that still persists, dizziness, trouble hearing. There's a whole slew of symptoms, and there isn't just one localized symptom that we have found can define post-COVID or long COVID syndrome. So it's just a slew of symptoms depending on the patient, depending on the severity of disease. And now looking at the variations in the type of COVID they had, the subtype. So was it the Alpha variant? Was it the Delta variant? Was it Omicron?
So you talk to a lot of people and they've said, I have COVID, but I'm still having shortness of breath. But right. I guess that will go away. But we're seeing a lot of patients coming into the hospital with respiratory issues, congestive heart failure, those kind of things. Do you think there is a relation to the COVID in that?
I do. And I think really it's a 2-part type of relationship. One is a direct effect of COVID. So some people who have symptoms of heart issues, symptoms of lung issues, maybe they had severe COVID and they develop some type of fibrosis of their lungs, and this is just a sequelae of that. But then there's also a subset of patients or individuals who have probably were on the cusp of having worsening of underlying disease they never knew they had. They never really had to follow up with their doctor, what have you. It was never a problem, right? So all of a sudden now, COVID just exacerbated their heart failure, exacerbated their possible COPD or what have you, or lung disease that was already there before, but it didn't cause enough of a problem that you really want to go see your doctor for. It's kind of like 2 subsets of pathologies.
So we had COVID, we're over it, and we're just assuming that this is just how it goes and it'll end in a minute. Should we be going and following up with our physicians? Because that might prevent a hospital stay, right?
Correct. It's really important to follow up with your physician. They know you well, especially if you have a family physician. The problem is that everybody who had COVID, we don't know yet the ramifications of the type of disease they had and what effects it has on their body. Because sometimes you can have these lingering symptoms that actually worsen. You had COVID a long time ago, and these symptoms are showing up like 3 months later, and it's just a sequelae of COVID or COVID infection or the immune response that COVID elicited that affected your body, and now it's showing itself 3 months later. It's really important to follow up with a doctor so they can follow that closely and make sure they can intervene early enough prior to it getting worse.
Now, you did a sleep apnea program with us not too long ago.
Yes.
So how does sleep apnea affect COVID or COVID affect sleep apnea?
So very good question. So actually, interesting enough, the National Sleep Foundation found that there was a lot of studies done where they saw people with sleep apnea, so moderate to severe sleep apnea, who were more prone to COVID infection or more prone when if they got COVID to have a worsening of disease. So that's one effect. The second effect is people who COVID actually, so if you already had sleep apnea, you're diagnosed with sleep apnea, you develop COVID. Now the issue is that you're requiring more pressure because of the effects on the lung. They're requiring oxygen at night. Maybe they needed to before. All they needed was just a mask and the CPAP or the BiPAP device. But now it's a little bit of a worsening of disease. So if they were a mild sleep apnea individual who had mild sleep apnea, after COVID, some people developed moderate to severe sleep apnea. They definitely need to follow up their doctor because this is a real and factual thing that occurs in patients who have underlying sleep disease or sleep apnea particularly, and then the need for reevaluation of their sleep apnea.
Just to remind our listeners, sleep apnea, you hear a lot of people saying, it's just a way to make money. It is true, creates heart disease. You want to expand on that?
Yeah, so sleep apnea is not just not a fake thing. It's actually a real disease. You know, we spend 8 hours, we should be spending 6 to 8 hours of our life every day, okay, in sleep. And a lot of hormonal changes occur during sleep. A lot of physiological changes occur during sleep. And that can play a big role on the rest of your body if it's not corrected properly. So, for example, when you go to sleep and you have obstructive sleep apnea where your airway is obstructed while you sleep, your oxygen levels decrease. As your oxygen levels decrease, that causes blood vessels in your lungs to tighten down or clamp down. If this occurs, it causes a surge of adrenaline in your body. And people, after a long period of time, have uncontrolled hypertension because of this. People can develop heart attacks because of this. They can worsen their heart disease. There's a whole series of books on what happens when you're hypoxic at night when you don't get your sleep apnea treated. This is a very big effect on, in general, in life, and even the quality of life. So we look at diseases, we say, how bad is the disease? And how does this disease affect my life, my quality of life? So if you think about obesity, people says, well, obesity is a disease. How does it affect my life? Well, I can't wear my skinny jeans, and it's really tough to bend over and tie my shoes, right? So that's a physiological effect of obesity, not to mention heart disease and everything else. So I'm just talking about in general. With sleep apnea, like, well, how does this affect my life? Sleep apnea actually affects your life when you don't even know it affects your life. You're more sleepy during the day. You have trouble getting up at night. You feel very fatigued throughout the day. Come 2 or 3 o'clock, you just want to fall asleep. Driving home from work and feeling sleepy and almost getting into car wrecks and so forth. This is a big effect that can affect your life. So sleep apnea is an actual disease that needs to be addressed.
Okay. And if you had COVID, it's a good idea to talk about sleep apnea with your physician when you follow up.
Definitely. Because it's not, the other thing with COVID in the sleep realm, it's not only that it affects the obstructive sleep apnea or the actual physiology of the oxygen exchange in your lungs. There's two components of that. People have increase in insomnia. It's also sleep disorder. So we found that people who had COVID are having trouble falling asleep, not only staying asleep, but actually falling asleep. People who had COVID also have rhythm changes in their sleep. So, we have these various stages, and we call it sleep stages, like your REM sleep, your good sleep, your bad sleep. So in people who had COVID, their sleep stages or sleep architecture is not like it used to be. And that can be also in disarray and needs addressing as well.
Dr. Ladi, we've had kids that have had COVID.
Yeah.
And now they're playing sports and everything else. Do we need to worry? Could they have damage also?
Pediatrics and COVID it's a very real thing. Kids who do get COVID can actually have ramifications of disease. And the big thing I think has been in the news a lot is myocarditis. Like a lot of viral infections, it can affect your heart, the muscle of your heart, and COVID is one of them. And we've seen reports where people who had kids who had COVID develop myocarditis or cardiac abnormalities like 3-4 weeks afterwards and have fainting spells and so forth. It's a real pathology. Right now, again, the data is all very fresh. We're only 2 years out of COVID. So we're looking at all these prospective studies now that are occurring that we'll be able to see the data maybe in a year or two from now and see what effects did COVID really have on a lot of the population, how to help us manage this. But usually my recommendations are if any child had a COVID infection, no sports for 14 days for the time of COVID infection, no sports at all. And then if it's a mild disease, after 14 days, they can go ahead and play sports. But to be wary if they have any symptoms of shortness of breath, chest pain, they need to be seen by their pediatrician or family doctor. If the child, for any reason, had moderate COVID disease, so sick enough to be seen in the hospital but not hospitalized, or children that were hospitalized, these children absolutely should not return to sports until they're seen by a pediatric cardiologist and had their hearts evaluated.
Every year the schools want sports physicals and stuff. And I know Oak Bend does sports physicals and has a cardiologist on site to do the rule out.
Mm-hmm.
I would think now, after COVID and everything else, it would probably be the best physical to get that also does the cardiac testing part of it.
Correct. So if your child is involved in any type of sports and they were diagnosed with COVID, evaluation of their heart is something that should definitely be done.
Great. Well, and I guess it's too early to really ask this question, if any of this lung damage can be reversed.
It's actually great that you asked this question. So yes and no. It depends on what effects the lung damage had, how's the severity of disease. A lot of the ones that are moderate or mild COVID and they had lung disease, they tend to recover, okay? Not overnight. It's a long recovery. There's a study being done right now. It just started last fall. It's called the UK COVID study or a lung study. And what happens is they're looking at, in the United Kingdom, they're doing a massive study with over 2,000 people and looking at people who had COVID, the various severity of COVID, what effects it had 2 years afterward. It's a big study. The data should be coming out at the end of this year. So it'll be an interesting kind of subset of, and there'll be a lot of subset studies as well. So that's something to look forward to, so we'll know more about COVID and the effects of COVID and lung disease. But also you have to understand, when we talk about recovery, there's two ways of looking at recovery for COVID. So long COVID, we talk about long COVID having breathing symptoms or a whole array of symptoms. That's the direct effect of the virus. So the virus directly affects the lung, it affects the lung tissue. That's one type of COVID disease, right? But there's also ramifications of COVID. So for example, being in the hospital for a long period of time, being in the ICU for a long period of time, that's a whole different type of long COVID. It's not directly from the viral effect, but it's that kind of ricochet of having COVID and now being debilitated for a long period of time. And there's that subset of people that need to be evaluated, and it's due to COVID. So the thing is this, people who have mild to moderate COVID lung disease, can they recover? Yes. It's kind of like getting a broken ankle or broken leg. You have a broken leg, you put in a cast. Once the cast comes off, you don't expect them to run. They still got to recover, right? Because they've been in a cast for 8 to 12 weeks. So it's the same thing with COVID lung disease. It's a process. You're going to have COVID disease. Think of your lungs being rested, like being in a cast. And then when the lungs start recovering, it's a slow road of getting better by slowly working with your lungs and seeing your lung doctor and so forth, and primary care doctor.
Dr. Ladi, as we close, and something I ask all physicians on here because it's so controversial, you have seen in the ER the best and the worst of all COVID.
Right.
Vaccine or not vaccine?
Ooh, very good question. Vaccine.
I put you on there. Okay.
You did. And I'm very, I'm a strong believer in the COVID vaccine. The reason why I haven't treated a lot of patients with smallpox or polio is because they got the vaccine. So that's the reason I don't see people in the ER with polio or smallpox. The same thing with COVID. I think the vaccine is important to have exposure to that for the immune system to be ready to fight it. COVID's maybe died down some, but it's not dead. So
Right.
just keep that in mind.
Dr. Ladi, as always, it is a pleasure having you on and having you teach us all these things. I'd like to invite you back
Okay,
and us
always a
talk about
pleasure.
some more stuff. But thank you for joining us today. And a big thank you to all of our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.